Hello, everyone. Thank you for joining me as I present to you my DNP project, Improvement of Glycemic Control and Body Mass Index through the use of self-management strategies. I am Dianna Hilson, DNP student, Maryville University. My committee members, Dr. Rita Wunderlich and Navis Carson Dunn, Master Educator for Providence Hospital and Certified Diabetic Educator. The introduction. The method utilized for this project was a quantitative respective chart review, a quality improvement project. The results were statistically significant and supported the use of the American Diabetes Association self-management strategies. The discussion was conducted around diabetes being a chronic disease, creating economic challenges and complications for patients. Diabetes affects 62 million people in America. 23.1 million are diagnosed, and an additional 7.2 million people is undiagnosed. So the purpose of the Qualitative Improvement Project was to determine if the hemoglobin A1C and body mass index measurements would improve with implementation of the American Diabetes Association self-management strategies post as compared to pre-implementation. The impact of increasing providers' knowledge of the current practice guidelines for patient self-management of type 2 diabetes could potentially decrease the complications and improve the patient health outcome. Complications resulting from uncontrolled glucose levels include, but not limited to, blindness, kidney failure, heart attacks, strokes, and lower limb amputations. An increase in the body mass index results in obesity and/or diabetes. The American Diabetes Self-Management Strategy includes guidelines for taking medication, eating healthy diets, exercise, and monitoring the glucose and the BMI levels, in addition to maintaining a support group, following up with appropriate providers, whether it's a podiatrist or ophthalmologist, doing the things that is required to improve their health outcomes and preventing complications. Using the ADA strategies is a cost-effective intervention. It costs little of nothing, just paper to print the guidelines and provide them to patients. That's significant. The American Diabetes Self-Management Strategy provides awareness that will benefit the person living with diabetes as well as their families, their communities. The improvement of health care requires evidence that is clear and measurable. That is the goal of this quality improvement project, to provide evidence. Diabetes is one of the leading causes of morbidity, mortality, and death globally. My story. This study is significant to me, the researcher, as my mother suffered from diabetes for over 31 years and succumbed to her complications in 2019. She had a massive heart attack at age 60, had a quadruple bypass, had a femoral bypass on one leg a year later, the other leg shortly before her death, ended up having a toe amputated, her kidneys were failing, and she called herself doing the right things, but no one never provided her with the self-management strategies. She didn't know that she, in addition to taking medicine and following up with her doctor, needed to exercise. She was a very sedentary person. Support for the project. The clinic in the Midwest region of the United States supported the project. The clinic manager, the physicians working in the clinic, and the nursing staff. The diabetic educator for the hospital, in addition, also supported the staff with the hospital IRB or Institutional Review Board, as well as Maryville University. Benefits to practice. Providers in the clinic accepted the project. They welcome improvement interventions for patient outcomes. The underserved population received quality evidence-based care with the implementation of this study. They received the self-management guidelines. Several responded and improved. Reduction in complications and cost of treatment are both vital for a greater healthcare system. The literature review was conducted using various databases, including Cochrane, Medline, and Clinol, all of which were found in the Maryville Library. A total of 8,200 articles initially were discovered. The search was narrowed down to 33, of which 11 were synthesized. All of the articles were in English. They were peer-reviewed. They were academic articles published between 2017 and 2023. As the project progressed along, additional articles and books were identified and utilized in the study. The body of evidence. Here are several of the cases that were conducted previously prior to this QI project that were included. These are just for informational purposes only, but these are the cases that were synthesized. Within those cases, gaps in the evidence were discovered. There is a significant limitation in the number of studies directly related to self-management strategies and the effectiveness on blood glucose and body mass measurements. Weaknesses were discovered. The most and the main major weakness was the social determinants of health that affected the outcome of the study because the study was conducted in a underserved, uninsured, low-income neighborhood. Complying with follow-up labs and BMI measurements was difficult for these patient population as transportation was an issue. Coming back to the clinic in 3 months exactly didn't fit their schedule. The study also had a small sample size, and the time frame was limited for the conduction of this study. The strengths of the study. The study eliminated any chance of selection bias because of the researcher utilizing a quantitative exploratory design through a retrospective chart review and the use of a sampling selection process. Education provided to the providers and the patient in the sample population was a strength for the study. The theoretical framework. The Pender's health promotion model is most related to the use of self-management strategies, and it fit well with prevention of disease. So it was selected as the theoretical framework. The methodology. Initially, a needs assessment was conducted and revealed that diabetes is a chronic severe condition and has significant health concerns. So a qualitative exploratory design through a retrospective chart review was selected. Participants were not engaged. No patient identifiers were abstracted from the electronic medical records. The researcher recorded only the minimal necessary data after the 3 to 6 month period of time passed, and it was collected on a data collection sheet. Excuse me. The setting. This clinic was located in the Western United States. Participants were selected from a sampling of the patients reporting to the clinic who are already diagnosed with type 2 diabetes. The inclusion criteria. Participants must be 18 years or older. All participants were 18 years or older and as old as 89. Diagnosis of type 2 diabetes had to already exist on the chart. The patients had to be seen in the clinic during the study time frame. The educational intervention of the American Diabetes Self-Management Strategies had to be provided and had to be, the patient's charts had to have documentation on a follow-up visit being conducted with a blood glucose monitoring measurement and BMI measurement. The exclusion criteria. Patients that were less than 18 years of age with no current diagnosis of type 2 diabetes, or patients that came before or after the study time frame was set, individuals with no follow-up visits and no documentation, and patients with documentation of gestational diabetes or pregnancy were excluded from this study. This is an example of the data collection tools utilized during the study to capture the information about the patients. Each patient's information was assigned a chart number and coded according to the scale at the top. Data collection, reliability, and validity. Data collection tool was developed by the researcher, myself, utilizing the American Diabetes Association self-management strategies. These were evidence-based strategies already available to the public, but not readily being given to the patients in this particular clinic. The tool served to establish how the researcher would quantify the validity of the study. Protection of human subjects was considered, and the institutional review board of both the hospital and the university were required. The Health Insurance Portability and Accountability Act privacy rule was followed. Coding of the patient identifiers were conducted, and the data sheets were stored in a locked file cabinet in the office in the clinic. This is the data analysis in a bar chart. The demographics are ethnicity and race, with African Americans being the predominant participants in this study. The age group ranged from 50 to 69, but as high as 80 plus years of age. More demographics. These are the genders of the participants and the glucose monitoring type. Most of the participants were male, and most of the patients utilized intermittent monitoring, 35 out of this 41. Here is the data analysis results. The post-intervention body mass index decreased 18.48%. The post-hemoglobin A1C decreased 18.60%. Significant improvement. The results were obtained utilizing an upper tail z-test for one proportion. This test determined the significance of the differences between pre and post-intervention variables examined, i.e. the hemoglobin A1C and the BMI measurements at the 3-month after implementation point of time. The clinical significance, first for the hemoglobin A1C, the p-value was less than 0.001, which is less than the significance level of 0.05. And because of this, there is sufficient evidence to suggest a decrease in the ratio from pre to post intervention for the hemoglobin A1C measurements. The achieved power of this study was 0.9971, which is considered high strength. So when we looked at the BMI, the p-value less than 0.001, which is less than the significance level of 0.05. There was significant information to suggest a decrease in the ratio from pre to post intervention for the BMI measurement as well. The achieved power of this study was 0.9643, which is also considered high strength. The discussion. The Quality Improvement Project utilized evidence-based practice data to create the Doctorate of Nursing Practice project. This DNP project examined the efficacy of the intervention of the American Diabetes Self-Management Strategies. The study compared other studies that utilize self-management intervention. The data was in accordance with the study guidelines. The statistical significance was found, indicating that there are benefits from utilizing the American Diabetes Self-Management Strategies. The theoretical framework for the Doctorate of Nursing Practice project is the Pender's Health Model, which is appropriate to support preventing complications of this chronic disease. So in conclusion, This DMP project demonstrates a need to educate providers and patients on the benefits of utilizing the American Diabetes Association self-management strategies. The intervention reduced the sample population's hemoglobin A1C and body mass index measurements during a 3-month time frame for the project. Several findings from the data collected provided evidence of the need for more educational interventions to empower patients to get involved with their health care. Future research is needed with an extended implementation timeframe to increase the participation in sample population. These are my references. Thank you. Any questions can be emailed to dhilson1@live.maryville.edu. Have a great day.